Hi, Congressman Rehberg. My name is Melinda Gopher. I was born and raised in Great Falls, but I live in Missoula. I'm a Native American. I'm a Chippewa Indian. I really commend you for the hard work that you do. I realize you're representing the largest district in the United States. And I think the onus is on you as well to, whether people agree with you 100% of the time or not, to really understand you represent people of all stripes and colors in your district. First of all, I'd like to invite you to Great Falls to help with some of the healthcare issues that we have with the Native American community there. You mentioned earlier that you have, some unfilled slots. You don't really know where you're going to be. And I really encourage you to go there.
I'll be in Great Falls, by the way, on Tuesday.
Okay.
James Parker Shields used to work for me, actually.
I'm a good friend of James. Well, we've been,
Yeah, he was on my staff originally. He's
Yeah.
a little shell, and we're trying to get the recognition to the little shell.
Yeah, and I think some of these health issues that we're facing there kind of interface with that. I think one of the things I'd like to talk to you with about on that issue is, just very briefly, is this whole issue of sovereignty and some of the mismanagement that has occurred in our tribe. I'm a member of the Rocky Boy family, and we are a Chippewa band that was recognized. And I think this kind of talks about some of the things that some people mentioned in here with, when government interferes. And the government interfered with our role 80 years ago, and we haven't been able to straighten it out since. And I would like your help to begin to address that. And on that, your bill for the little shell, if there's a possibility of amending that, I would really like to see that at some point down the line, because I think that...
Well, the little shell wrote the bill, so if you've got suggestions, I'm happy to do that. My staff will try and explain all the things I'm doing with the sovereignty and the tribe issue. I do visit all 7 reservations continually. My mom was born and raised in Lame Deer. My grandpa worked for the BIA in the telephone program, and it was one of those weird things. I grew up with my great-grandfather. We didn't realize he'd been married before, my great-grandmother, but she's buried down at Battle of the Bighorn, which means something. I do. I spend a lot of time and effort, and in fact, I'll be able to say the scrutiny on Thursday. And literally, a lot of my time is spent on Indian health, on job opportunities on the reservation. If there's something in the bill, I'd be happy to work on it. Okay. But frankly, the little shell wrote the bill. Okay. I mean, they helped me design. So if you've got a problem with it, you better first of all talk to them.
And when we're doing that, I think that's happening. But I also wanted, to give Molly Booty a shout out, who is, kind of prodded me along here today, and our effort to try to get the Indian Healthcare Improvement Act to do some work and at least bring a statewide voice to that, and hope that you can work on that with us. And lastly, what I wanted to ask you is, my concern is I am, like I said, I'm an urban Indian. I am low income, and I have a pre-existing condition, and I'm uninsured. And, I don't care who gets it done, if it's Democrat or Republican. I would like to see the poor people of this country not die over the lack of health care. And right now, I don't qualify for Medicaid. And so, sir, if there's something you could do to bring something to the table in this whole health care to make it stronger for people that are low income, people of communities of color, and also our elderly people of every race that, that they're not facing medical bankruptcies. My heart breaks every time I see a family facing medical bankruptcy. They are the leading cause of bankruptcies, and I would like to see something done about that.
Okay. All right. And one of the, I was elected in 2000. Took office 2001. My predecessor was Rick Hale. A lot of people don't remember him. He was there for 4 years. And the best advice, and actually the only advice, he didn't tell me where the office was or what the phone number was or any of that stuff. I figured it out on my own. But the one thing he actually did tell me that was great advice, and that is join the Rural Health Caucus. And it's separate from the committee system, because you can't be on every committee, and there's like-minded people. And his recommendation was, look, we just view things differently. Cleveland actually is the largest hospital in the nation, bigger than Mayo or Los Angeles or anything like that. And those from Cleveland and their representatives and senators and those from Los Angeles, they just see it differently. And they write tax policy and medical policy and healthcare reform from their perspective, but they don't have the same perspective that we do. And I did join the Rural Healthcare Caucus. The other thing that I've been trying to do the last 3 years is convince Nancy Pelosi to do what the Senate has done, and that's created an Indian Affairs Committee. It's buried in the Resources Committee. I have no complaints with Nick Ray Hall from West Virginia. He's a delightful guy. When I was a young staffer supporting my wife in Washington while she went to school in 1979, he was in Congress and he's still there. And so, you know, his ideas haven't changed much over the years, and I've been trying to get him to convince to give up the responsibility of Indian Affairs out of his bigger committee that deals with mining and forestry and all that kind of stuff, and allow an opportunity to focus on the unemployment and the healthcare issues and the trust responsibilities and all of that goes along with the Native Americans. And so far, Nancy has had a 10-year. I cannot convince her. I will continue to do it. I'll be beating up on her. I've got to try and convince her that what's good for San Francisco is not good for Montana. But right now, I'm not winning. Again, I better run, but I thank you. And trust me, I'm pretty thick-skinned. I haven't got much self-esteem left. You know, you're in public service for an extended period of time. There's nothing that has been said today that I haven't heard, including from my own kids on occasion. This is what it's all about. I put myself into this for an opportunity to hear those that agree and disagree, but nobody's ever really disagreeable. I mean, some people, you know, sometimes carry it a little too far, and maybe so do I. But that's what's neat about America is we can do this without fear of recrimination. We can walk out the door and have a beer together if anybody wants. No. But this is just an opportunity for you to see me, if nothing else, feel comfortable, I hope, with my staff. They're truly good people that are trying to represent you, that work for me. You know, and we're like everything else. We make hiring mistakes too, and we try to minimize those. And we're a reflection of Montana society. I love representing you, and I just thank you for giving me the opportunity to continue to do it at least for another year. And good day, and God bless you all.